Yeah, oh, yes, and push your little button there and let go.
Heidi McKeith from Gillsville.
Beth Killian from Arcadia.
Melissa Youngbauer, ADRC Supervisor.
Sammy Becker, Nutrition and Transportation Coordinator for the ADRC.
Joan Sasala from the Independence area.
Becky Rick, admin for ADRC.
Colleen Schwarke from Osseo.
Rachel Herman, volunteer from Pleasantville.
Phyllis Olson from Blair.
George Brandt from the Ettrick area.
Dom Aldera, District 11 Supervisor.
Thank you, everybody. And Kevin, you got all that? Yep, all right. I'll certify, because I assume it's correct, that the open meeting laws have been met by various proper postings and so forth. Okay. We have a 12-item agenda. I would entertain a motion to approve the agenda.
I move to approve.
I'll
Dawn,
second.
Second by Beth. Any other questions, things that need to be explained? This is really difficult. Right now, you're a blur. Now I can see you, but I can't see my paper. All in favor of approving the 12-item agenda, say aye.
Aye.
Aye. Opposed? Okay. Let us review the minutes of our August meeting. I imagine we've had a chance to look through them. I would entertain a motion to approve those minutes. Anybody?
Move to approve.
Okay, Dawn, second. Any questions, corrections? No? All in favor of approving the minutes as printed, say aye. 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 Opposed, same sign? Okay, we're on to number 6 already. Review and discussion, 26-27 nutrition program request for proposal. Who's got that and what's that about? Melissa?
That would be me. So today I am presenting our
Do you have your thing on? Yep. You do?
I
Okay.
do. Yes.
There
So,
we go.
yes. Today I am presenting our 2026 to 2027 nutrition contract proposals. So we've completed the RFP process. And so in front of you, the one handout, so it's a one-sided handout. This is a summary of the RFPs. So we have had a chance to review the rates, look at operations, and look at the budget impacts. So let's start with a few key updates. And as we're talking about the key updates, you can refer to the summary. And so we received bids from all of our current providers. We did not receive any bids from any new providers. Just wanting to make you aware of that. So the good thing is that people like working with us and providing meals and nutrition to our customers. There were moderate rate increases with all of the providers, minus Eau Claire County. They did not have a rate increase, which was incredible, and they are our lowest rate. So if you remember back at our June meeting, we participated in a discussion. You just participated in a discussion about our nutrition program. You also completed surveys at that time about our nutrition program. Really, what came out of that survey was that you all supported the status quo. You liked what was happening. The only thing that really came out of that was you'd like us to be able to do more, okay? We also completed customer surveys in August and September of this year. We're still getting a few of them back, so in the future, we can actually spend more time looking at those. Those surveys also showed that our clients are really satisfied. And they showed that the quality of the meals and what we were doing was really steady. They were very good surveys. We also had already, like a while ago, our fiscal manager had been working on our budgets for next year. And in that budget, she did put in a 12% increase of the budgets, nutrition budgets, to prepare for an expected increase in the food costs. So what we're seeing is that we do believe that budget increase would cover the cost of the food providers' increase. So before I move into any proposed adjustments or plan, are there any questions about just this general update and this handout of what you are seeing in front of you? So what Eau Claire County, they provide only the home-delivered meals, and they provide meals to the entire northern part of the county. So that would include Osseo, Oliva, Strum, and Pigeon.
So when you say Eau Claire County, you mean Eau Claire County?
They're ADRC, yeah.
Oh,
They
they're
have
ADRC, okay.
Yeah, they have a kitchen, an industrial or commercial kitchen, and they serve, they provide meals to us, Eau Claire County and Chippewa County.
How cool.
Are there additional expenses for transporting the meals? Like if we went with Eau Claire County, they'd have to drive a lot
So
to get them
we've
here.
done a cost analysis, and just I like to tell people like a little bit of the history of this. The reason we got involved with Eau Claire County was because prior to even our last contract, Dove in Osseo was making our meals for our northern part of the county. We put out a request for proposal at that time, and we could not find anybody that was interested in doing them. And so at that point, we reached out to Eau Claire County, and that's when that partnership began. So we've done the cost analysis, just, now as we've been looking at this, and we have determined that it is more economical to continue to go into Eau Claire County versus getting the meals here because of that lower rate.
There seems to be some regionalism going on in a lot of areas with services these days. I mean, that's
Yeah.
just a statement of my observation.
And looking at Eau Claire County, what they've decided to do, it's pretty impressive. The facility that they have, their cooks are full-time cooks. They're providing all of the meals for their senior meal programs as well. And it's of course that would have its challenges. But I think that it's what they do, I think is pretty great. It's working for them, and they just built this kitchen, spent millions of dollars a couple years ago.
Any other questions?
Dawn, did you have a question?
Yeah, so how do we get the meals here? Is it a volunteer that drives up to get them? We pay mileage? What does that look like?
It's a paid driver that does that. So he comes from Whitehall or from Independence is actually one of the two. I think his vehicle is kept at the highway shop. Yeah, so he leaves from the highway shop. And so then he is going to Eau Claire to pick up those meals. And then he has several drops that he makes. He drops them off. He does a drop in Osseo where Osseo volunteers deliver all of that Osseo route. So Colleen is part of that. And then he delivers the meals in Oliva and Strum every day. He's one of our 5-day-a-week drivers. And so when we analyzed it, we looked at that, so the extra cost, because he would be coming from here to go deliver those meals, the extra cost would be in his staff time in that 15 miles or so to get from that northern border, that very northern point of Leverstrom to Eau Claire. So it's about 15 miles, 12 miles one way to get to the kitchen.
But that would only, okay, so I think I'm just confused. So it would take all 5 of these providers to feed the entire county?
It does take all 5 of them, yes.
Okay.
Yeah.
I was thinking Eau Claire County, like
Did
if
all
we
of
went
them?
with them, then we would be taking the meals to Galesville. I'm like, how?
No, yeah.
Okay, yeah.
I think sometime we should just bring a map here too, so that it is actually really nice to be able to look, and we could map that all out so we can show you. So no, so he is only going, yes.
That northern region.
That northern region, and then, like I said, so he is already also delivering those meals to that Leverstrom area, and then doing the drops at Osseo for the volunteers and Pigeon for the volunteers.
Well, we gotta hope we don't lose him.
Right.
Okay, I get it now.
Yeah,
Thank you.
does that clear it up? Because it is, yeah, that would not be economical, would it?
So
No.
for those of us from the southern part of the county, it's just the hinterland, there be dragons, it's on the map,
Yeah.
anything north of Whitehall.
Yeah, but I do like to
Scary.
explain that too, of how did this come to be that Eau Claire is in the mix? But we are really satisfied at their product. We think that they do a really good job. And, again, we wouldn't, if we had other options at the time, we wouldn't have ever entered into that, agreement. Yeah. Are there any other questions about just the updates okay. So there is one adjustment that I do think that we should possibly consider, so I'm gonna bring that up to you at this point. It is something to consider that would help improve cost efficiency a little bit. So I think we do need to just at least consider ending that Grandview Care Center contract.
The what?
The
now?
Grandview Care Center
Oh,
contract.
okay.
And that's in the home-delivered meal bids. They have been a valued provider, I will say that. They really stepped up, 3 or 4 years ago when we had Rainbow Cafe close. They did step up for us. The reason that I think we should consider possibly ending that contract is we could shift those meals to Tri-County. Tri-County's bid is $1.75 less per meal. And right now, Grandview is providing meals to Ettrick and to Blair. And so those drivers are coming from Whitehall to begin with. So they are leaving here. They could pick up the meals at Tri-County. Right now, there are only 8 meals. It varies between 8 and 10 meals per day that are coming out of Grandview. So it is not a large amount of meals that are coming out, but it would help Sammy and I just with efficiency, because you've got one less provider to review menus, to type menus, just all of the admin, all of the paperwork for just such a small volume. So it would streamline operations and reduce costs just a little bit. So I guess I would welcome any feedback on that proposed shift.
Anybody?
Make any waves anywhere. It's 8 to 10 meals. As long as the quality is there, which we already know, I don't see a problem.
Yeah, I think anything that improves efficiencies, especially if it makes sense financially and for all the other reasons, then I would fully support that.
I agree. Should do it as long as Tri-County is willing to absorb those 8 to 10 meals. That would be
They
good.
are.
So-
Tri-County did step up in the last month when we had some unplanned kitchen changes at Wanik in Arcadia, and they absorbed all of the Arcadia meals, so that's around 20 25 a day. And I will say that Tri-County, their quality is really exceptional. I think they're right at the top of the HDM providers, so.
Sound good? All right.
Do you need a motion or anything like that?
I think it would, well, should we go then, let's look
Sure.
at the overall recommendation.
Yep.
So our recommendations, we feel that our recommendation is to sign contracts with our current providers and maintain the current service levels. So we're not looking to make any changes in what we're currently doing. Minus that one change to end the Grandview Care Center contract. This would stay within our budget of what that increase was that we had built into that budget, though we do not anticipate any capacity to do any expansion at this point. So I guess I would open it up then for additional questions or feedback, and then I think at that point that we would look at
So,
possibly.
with the exception of taking out the contract, so this is a annual contract
2-year.
2-year
So
contract, with the exception
2026 to 2027.
of stopping the contract with Grandview. Have you communicated to them?
I have not. I wanted to get feedback here before I
Okay.
wanted to just make sure that people felt, that you all felt that it made sense. So no.
So basically approving the summary less and taking out the Grandview Care.
And continuing what?
With current services.
Current services. Not looking to change days anywhere or make any adjustments.
I'd entertain a motion to that effect.
So move.
Thank you, Dawn. Is there a second? Second. Any other discussion? You just raised the possibility of changing, or the issue of changing locations and so forth, but everything is good that way?
I think it's great, and I think I'm very pleased that those bids came in where they did. It could have been a higher jump than it was, and again, I feel you all in June, goal was to continue or possibly increase, and so I think it's, and the customers are also indicating they're happy with what we're doing, so I think it's good.
All right, we have a motion and a second. Any other discussion or questions? All in favor, say aye. Aye. Opposed, same sign. Okay, sign those contracts and
Okay.
send somebody with a box of Kleenex to Grandview.
Yeah, I know, and like, I do want to just say, I do appreciate what they've done. They were doing a lot of meals at one point before we had some other providers, but I think they will be okay. Again, the volume is so low, I think that,
Or maybe I should just get some people fired up in Ettrick.
yeah, there you go.
Yeah.
They're Monday through Friday, so, yes, Monday through Friday.
Review and discussion, this is no action on the Specialized Transportation Assistant Grant?
Right,
Okay, all right. Who's got that?
that would be me. You're gonna get tired of hearing from me.
Not at all. We missed you last meeting, by the way.
Okay.
The guy you sent didn't know anything.
Okay, so the 8521 is a specialized transportation assistance program, and it's been around for a very long time. It was established in 1978. It's funded by the Wisconsin DOT, and it's administered locally by counties. And so it's administered locally here by the ADRC. So the whole goal of this program is to support the health and welfare of the elderly and disabled adults in our communities by improving their access to transportation. So for 2025, the local statewide funding is 16 million. So I do have the allocation, I gave that to you so you can compare what we receive and what other counties receive. Our amount has stayed the same for several years. I would have to look back and see, but for sure it was the exact same last year. With this grant, we are required to have a local match of 20%. So wanting to make you aware of that. And so what we are here today to do is to just talk about how we do use those funds. In the scheme of things, that $79,889 that we receive and that local match of $15,978, it allows us to do two programs. We do our bus service, and mainly what that is we are traveling to Eau Claire and La Crosse. And then we also do, we call them Fun Day Travels. Those are the social opportunities that we do things like this month. I think we are going to Schwertels. So those kinds of things. We have trips planned in November and December to Eau Claire and to Chippewa and La Crosse to go look at the lights. Those are the kinds of things that we do with our bus service. Our local van service, that provides rides in our county to medical appointments, nutrition-related needs like shopping and errands, banking, and again, social outings in our county as well. So the 8521 funds cover staff wages, fuel, vehicle costs, insurance, and all other expenses really related to operate our transportation programs. We do feel that these services are currently meeting our community needs quite effectively by providing reliable transportation. And at this time, we are not proposing any major changes to the programs. If we had more funds, certainly there would be needs, especially when you look at out-of-county needs. But we do not have any funds that would cover expenses like out-of-county transportation. So we did include the budget summary. That's another one-page sheet that has been given to you so that you can see the local van service, what the expenses are, and the bus service expenses are. So I'm seeking just feedback on this plan before a public hearing that is scheduled tomorrow. So any of you are certainly welcome to attend that tomorrow. And again, just the idea of what do you think of asking people what, feedback for what we are doing. And before it would go to the board, to the county board, the Health and Human Services Board would need to approve this plan later this month. So any questions or any feedback about this plan and how we use the money? How we use the funds?
So just, I'm seeing, so this is the 2026 budget summary. You're saying they're identical or very close to 2025? Pretty much identical.
Very, yeah. So Kelly, who is our fiscal manager, did look at this year and projections as far as what are we spending more on, what is more utilized, as that's based on that. The local van service, it costs more to operate the local van service than it does for the bus service. So the numbers are close to last year, but shifted a little bit because of the usage of the local van.
Being flexible, looking at the numbers, yeah.
Dawn, did you have a question?
I think so. I'm still puzzling it in my head.
Okay.
So is the total allocation for Trempealeau County then, or between the state funds and Trempealeau County, are we at like that $86,000 mark? So that 15,000 is on top of the 79?
It is,
It
correct.
is. Okay, because at first I was thinking it was, that
Part
went
of
back
it.
into it, it was part of it. Okay.
Well, it would be, so, I don't have a calculator with me, but, so, I think it's about 5,000, isn't it? Like, that would be over,
79. Oh, sure.
yeah. So,
Okay.
I think so.
So it all adds up.
It all adds
Take
up,
it.
and it's a little bit of levy that would be used to.
That's what I was
That's what-
thinking.
yes,
It doesn't quite meet the costs.
Right,
So there are levy dollars
yeah,
there.
there are.
And that's been true in previous years too,
It's
I
actually
believe.
less, yes, than what we've had in previous years, less levy. Is less, I will speak specifically to last year's less levy than this budget than 2025.
How is that possible if the funding hasn't changed?
Levy,
No, I know, but the funding that we're getting hasn't changed, so our expenses, I'm sure, haven't gone down. So why is there
Right.
less levy?
hoping to be more efficient.
Okay,
Yeah,
perfect,
mhm,
great.
Yes.
Okay.
Dawn likes that word. I'm getting that, yeah. Oh, look,
And I will say, I will say, Sammy can speak to this as well, but we are seeing a bit of a decline in requests for transportation. Not sure exactly why that would be, but we are seeing it.
Do you know what kind of usage we actually are getting out of, like, every trip? Is there 5 people or 20 or like?
We could give you very specific or detailed information if you'd like us to present that. Usually we do that at the end of the year, so at our annual report that we typically prepare in January, we would give you very detailed, so, we can tell you exactly how many rides were given, and the purposes. But we also do we're required for this grant to do quarterly reporting, which is very detailed, which includes the exact number of people that we're transporting, what their age is, the
Yeah.
purpose of the trip, all of that. So we do, right now, we're working on the Q3, so, yeah, we could always give you that information if that would be something you'd like.
I guess if we're coming down to making decisions about whether we do something or don't do something, it's good to be able to see all of the detail behind it, but I don't think that's what you're asking us today anyway, is it? So,
We have at different times gotten feedback regarding just like the frequency of bus trips, things like that, where we have looked at the usage. We did actually cut down. We were doing monthly trips to Eau Claire and La Crosse.
Twice a month.
Yeah, twice a month. We were doing weekly. I meant to say weekly. And Becky is here, and Becky does a lot of the scheduling as well. So she's another person that can give us feedback. But we were doing weekly, and that decreased. The demand decreased, and so now we're doing one trip to Eau Claire a month and one trip to La Crosse a month.
We'll talk about that, Becky. Who's using the trips to Eau Claire and La Crosse? And what are the purposes?
I would say the purposes for the bus trips, to Eau Claire, La Crosse, a lot of people are using them for the bigger stores, so Walmart, Menards, Target. It is a lot of the same people every month. There's a few that add here and there, but it is a lot of the same people. And we do kind of encourage, if you live, in the southern part, you try to go to Eau Claire, and you live in the northern, try to go to La Crosse.
No,
Um,
the other way
I'm
around.
sorry,
Yeah.
yes, I said
See,
northern.
efficiency, that is
Yeah,
not efficient.
that's not
Dawn.
it. Northern to Eau Claire, southern
you.
to La Crosse. Try to encourage that. And, and those, it seems to be working fine. They know, some people schedule a month in advance or whatnot. So it is a lot of the same people. At one point, I think we did have quite the demand, and that's why we were going every week to one of them, because our buses were full, and then we had to encourage people to choose one, and, you know, so everybody could ride. And now that it's really decreased. I think there's, you know, our bus seats 9, and I think, you know, it varies like 5 to 6 people, that go. And then, our local services are a lot of medical, I would say, and then errands, and we have a lot of the same people weekly that run, you know, the same errands, Quick Trip, Randy's, the bank, stuff like that, so.
Is there any particular criteria that a person has to meet in order to use the buses or the van?
Just 60 or older. That's. Or disabled.
Right.
And that's really the only requirement. You know, we've had some of the, you know, special needs classes in Whitehall, some of those students, ride with one of their teachers to the mall and stuff like that too. So, I mean, we have had younger
Oh,
people
that's
use
a-
it.
That's a neat tag. on
Yeah,
thing,
we've had
yeah.
younger people use it. We don't get a large demand.
Yeah, youth in transition that are
Yeah.
transitioning to adulthood, so.
So that would be like high school kids or?
Yeah, and like I said, they don't use it often, but we have had it, you know,
Maybe just putting it out-
done it.
Maybe just putting that service back out on Facebook again, just a reminder for people in the
Revamp it.
newsletter, you know.
Sure.
I think part of it is just that it's always hard for people to do something new. Like if I had a girlfriend who would go with me, then that would feel better, right? But if I don't, then I'm going by myself with this group of people that I don't know and never done it before, so it probably doesn't feel real comfortable for people, but
Right, yeah, my grandma just went on her first one, and I was so excited to see her on the schedule, 'cause I'm like,
Nice.
yay, she's doing it, so, yes.
Yeah, I will just say, I think in the future, we definitely could start promoting it more. It's kind of been a balance, because at one point, we did not have enough drivers to even meet the demand. And so then, we weren't doing a lot of advertising, and so.
So these are paid drivers or volunteer?
For this program, they have to be, they have to be paid staff.
Okay.
Yeah.
Okay. And then,
Like our county right now does not allow volunteers to be providing transport. So that's just not something that we do, so.
and our
they're all-
vehicles are in good shape? Are there issues with having to invest or?
So that is an ongoing, that is an ongoing conversation. And so we do have a plan of when we would be replacing vehicles. We actually did sell 2 vehicles just in the last 3 months. And so I had just talked to Jay last week about just starting to make plans about when we are going to need to replace one of our vehicles. The van, or the bus, is it a 2016? I think it's a 2016. It has about 130,000 miles on it. So that's getting to the end of probably where we would want our one bus to be. So that's probably something that and there is an option, we could apply for a 5310 grant, which we have, I think, right now, 3 vehicles. Our current bus was purchased through that grant, and so there are state dollars where we could apply and get funding to purchase a bus. I think that is probably what we should be looking at doing in 2026.
So check with your motor pool staff and have them make their recommendation. The grease monkeys in the garage.
Yeah. I think we have, is it 5 or 6 vehicles in our fleet right now? 6? 6, I think, so.
And our drivers do take good care of them, they're on top of things.
Anything else on that? Any questions? Oh, Heidi.
I see sometimes there's a limit how many can go to like the outings that, like you said, you're going to Eckers. Is it ever where you have to turn somebody away?
Yeah, so our bus seats 9 plus the driver, or 8 if somebody is in a wheelchair that can't transfer. And so, yeah, we have had to have wait lists. And that's why, again, we were telling, we had people that would go on both La Crosse, Eau Claire, and really just try to limit so everybody can get on. But it is first come, first serve. And if our fun day travels, we have done, if they are, like say the bus is full and we do have quite a list on the wait list, we would take one of our vans as well to make it work, depending on what it is or where we're going. So we do try to accommodate everybody.
It just is really varied, yes. I don't know if the economy has something to do with people wanting to go. I don't know if that's a factor.
So Becky, for the people watching at home, do you want to throw a telephone number? How do you get in touch and sign up?
I'm Sammy, by the way.
Sammy, sorry.
That's okay.
That's Becky, sorry.
That's
okay.
I only see you every other month, so, yeah.
That's okay. Yeah, so they can call they can call Becky as well, at the ADRC, the 715-538-2001. She can help them, or, they can ask for me as well, so.
Sammy or Becky,
Sammy or Becky.
2001.
Yep.
Yeah.
And it's very reasonable, I feel. It's $5 copay for in-county and $10 for out-of-county. And they pay the drivers at the time of service.
There's a tip jar. No.
No, we do not allow tips.
No tips, okay.
tips.
Good. Well, that's good to know. Thank you.
Yeah.
Anything else? Anybody? All right, what's next? Nutrition Council report?
Okay, that's me. So just a little tidbit on the Nutrition Advisory Council. Our purpose is to advise, plan, and support best practices in the delivery of senior nutrition services. We, meaning these two lovely ladies over here, are also part of the committee. We were meeting every other month, and then summer arrived and it got very busy. We had people traveling and stuff like that. So it's been a little bit since we've met. But going forward, we have discussed that being that a couple of these ladies are coming already for this meeting here, we're gonna start meeting before the ADRC council meeting every other month. Kind of make it a little bit more of a easier thing. Yeah, more efficient, yes.
The E word, yeah.
Yes. So we do review the HDM and senior dining numbers for the previous 2 months, kind of see the changes if they're up or down, discuss events, look for input on other activities or things we could do. So currently there is only these two ladies, myself and one other lady, so we are always looking for more people. So if you know of anybody or if you yourself want to come and see what it's about, you're welcome to join us. We will begin those every other month meetings before the meeting in December. So you can definitely join us if you would like.
Because it's going to be in this room,
It's
probably.
gonna, is there something that goes on in this room beforehand?
There wasn't today.
No.
There usually
We'll see what is available, but ideally, yes, that would be nice. So I would say it's about an hour, so I'd say 9:30 we would meet, so. And then just a little quick update, last Tuesday, the state had, fall nutrition staff and volunteer training. So we closed down our meal routes or canceled our meal routes for the day so our paid staff could attend the training with me as well. So there was 12 of us total that went. And we learned about food safety, nutrition ed, and customer service. So in both the home delivered meal side and the congregate dining side. So excuse me, and they offer that twice a year. There's a spring and a fall, so it was really nice to be able to get the drivers out there too, to kind of get the, hands dirty and learn some new things, so.
Training.
Training, it's always good, always good. So, yeah.
Okay. Questions? Praise, you want to shower praise on her or anything? Okay.
Wonderful.
There we go. Oh, it's just marvelous, yes. So this is your report now. Go.
Yes, it is. Okay. So we are preparing for the very busiest time of the year at the ADRC. So, and I'm not talking about the holidays, but it is Medicare open enrollment. And so that begins October 15th. So we have our elder benefit specialist and the disability benefit specialist. They're just super, super busy. It's not uncommon for Rita, who is our elder benefit specialist, to be meeting with 6 people in a day. Very, very busy. And so we are also busy getting ready for the next phase of construction. Yes. And so what that means is that hallway that connects the atrium to the ADRC, that's going to be closed.
Oh, lovely.
So customers would need to go upstairs and then downstairs to get to the ADRC. So we came up with a plan that we think is hopefully going to work. I don't know if you've noticed, but there is a cubicle that was set up now down in the atrium. Just under here. Did you see that? It actually blends in. It blends in.
Yeah.
To me, it just looks like it was kind of meant
always
to
been
be
there.
So what we are planning is that when Rita, for example, makes her appointments with people, she can tell them, if you're comfortable with meeting in the atrium, we'll be able to meet you up there. So the security will send people to that waiting area, the couch there, and then Rita will come out from her office and then avoid people having to go up and down. So we think that was about the best solution that we could come up with. So yeah, when you leave, check it out, but I think it looks really nice.
So the next phase of construction doesn't involve your new suite of rooms someplace, or will you continue to be in?
Well, once they close that area, they'll be working on that space. So
Yeah.
what was formerly the extension area, that's going to be our new space. And so
Nice.
that's where we will then move.
Nice.
So, yeah, I think we're getting excited. It's gonna be nice, I think.
And closer to the entrance.
And closer to the entrance, yep, which, yeah, will be really nice. It's been a while since we've met, but we did receive a $1,500 brain health mini grant from WIHA, or Wisconsin Institute for Healthy Aging. And so that sign that's over there, we were also given $500 to use towards printing materials for brain health and dementia prevention. And so we're able to do a lot of cool things and just really focus on brain health. I think more so than we would have if we would not have gotten this grant. But we were able to do the yard signs. If any of you were here last month, there were yard signs that were out. We were successful. We had 2 press releases that were in our county newspapers that highlighted brain health. We had a PowerPoint presentation that was added and on our TV station. It's there and it's on YouTube that you can watch. And then we had a lot of social media posts, and we had the display down in the atrium as well. We also distributed materials to all of our home delivered meal participants, and we got that info out to the senior meal sites. So when I did my report with WIHA that was due last week, the reach was actually 55,000. So of course, there's a lot of duplication, right? And, some of us were on that list, I'm sure multiple times, but 55,000 people, so that's pretty cool, I think. So
For a
we were
county with
happy about that.
30,000, that's really good.
I know.
Yes.
Yes. Also wanted to just highlight, we just completed farmer's market voucher distribution at the end of September. And so we distributed 204 vouchers this year. So 204 people got vouchers. That is down a little bit from last year. But we're still really proud of that. Example, some of the similar sized counties to us, for example, Vernon County, which is very close, that's one of the closest counties to us, they received a total of 99 vouchers. We received 235 and we distributed 204. It's just because we've done such an awesome job of distribution, they keep increasing what we get. And so, so that's pretty cool. People have until the end of October to redeem those vouchers with the farmers that are participating. So, and that is something too, we use the transportation on. Well, example, we're going to Schwertels, which they do have the vouchers. You can use vouchers there. But we also have given people rides to farmers markets in the past. So, September was Fall Prevention Month. If you read our newsletter, you saw that we had that bingo challenge. And so people could put their fall prevention strategies to work. And we had 55 bingos. And so that's pretty cool. We've not had, we did?
I took them that day, yeah, I took a bunch.
Are you sure?
Do you have more there?
Well, I thought they were still in the folder on
Maybe they were blank.
I'll check.
I did take
Okay.
a bunch from there.
Okay.
But it was a while.
If you find any
It was a
more,
while ago,
let me
so-
know, and then we'll do a separate drawing for Strum. And then we have more than 55 bingos, but
It was
that's,
a while ago, so there
Oh.
could be some there.
I thought they were still there on Thursday, but when I worked, but
ooh, okay. Well,
check.
we thought we had gotten all of them.
These are drawings for what? What did I miss?
So in the newsletter,
Read your newsletter.
yeah, there was a major focus in the last newsletter on fall prevention. So there were articles and different fall prevention strategies that were highlighted. And if people were to participate in and put these fall strategies into action, they
Oh, you
could
put it-
cross off for the bingo
Yeah.
and then turn the bingo in and to be eligible for a prize. So, yeah.
And the prize is just some ADRC swag and.
Oh.
Yeah.
It isn't a new Chevy pickup.
It's nothing.
not
No,
too
Okay.
big.
so that's what I'm saying, if there were still some that didn't get, we would do another
Yeah.
prize, yeah.
Swag.
But so that was pretty fun. Just gonna go down a list of some other scheduled activities and events to round out the year that are planned. One thing that we just started last month was our dementia care specialist is now doing memory screenings in all of our counties. So she's going and rotating once a month, doing memory screens. And so in September, she had done the first event in Trempealeau, and she did 10 memory screens. So that's a baseline. People go
Right,
in, meet
right.
with her, and you get a baseline to find out, how is your brain functioning? Where are you at? And then you can compare that, a lot of people, I believe it's suggested you do those annually. And you can see where you're at. So that is a big success to do that in Trempealeau. 10 screens is pretty great. We were really happy with that turnout. So she has another event scheduled this month in Independence. So we've been highlighting that. I do have a flyer back over there, but that event is going to be in Independence, partnering with the Independence Library. So, and we did learn we do need more than the one staff there because it was busy, and that's great because I'm going to be going to that event in Independence, and then we highlight all of our events and all of our programs and services. So, so stay tuned to hear about that. Next week, we have an intergenerational activity we're planning after Cafe 60 in Whitehall. So we are Whitehall School, their, is it their
Life skills.
life skills class is coming and doing an activity with our seniors after Cafe 60. The middle school. We have a pop-up senior lunch and a harp concert, so we're partnering with the Independence Library, or, I'm sorry, Osseo Library. So they're having a harp concert and then a pop-up senior meal after that. That's gonna be on October 29th. So again, targeting those communities where we don't normally have, or we don't have a ongoing senior dining experience. I'm really excited about an advanced directive training that we're having on November 19th at Tri-County. So we talked about that months ago, Dawn, if you remember that, and we were thinking about how we could make that happen. And so that's going to be November 19th at Tri-County. Advanced directive.
Oh, perfect. Yes, we talked about that.
Yeah, so that's going to be great. Beth Rhodey, one of the social workers, is going to be leading that conversation and
Is
training.
that something that's been out on Facebook too? I
yeah.
have not been seeing Facebook posts from the ADRC. I'm gonna have to
Check into it. Every day, there's at least one, but. And then Strong Bodies is just going really, really well. That's our evidence-based strength training program. We have a class right now operating in Osseo, and we had to cut off the attendance of that because there was such a strong interest in that class. And now we have 2 new instructors that got trained. So we have a class starting in Trempealeau in January, and we have another class starting in Whitehall in January. So that's, yeah, really happy with how that is working.
North, central, and southern, nice.
I know,
Yeah.
that's what our goal has been, and we'd love to expand it, so to every community, but at least it's not too long of a drive, to get to any one class. And, wanted to also let you know that, I just became certified as a stepping on falls, I became certified as a stepping on falls prevention instructor. So that is another evidence-based program, and it's a really great program, all aimed at preventing falls. It's a 7-week class, and it's got a last session, like so the 8th session is a follow-up. I lose track of, I think you meet maybe 6 weeks after the class concludes you meet and you kind of just check in with people and what were people able to implement. But I have proposed to Tri-County. I've asked Tri-County if they would be interested in participating in that class with myself, because the class does require experts to join you for the classes, such as a physical therapist, an eye doctor, and a medication expert. So I know that Susan Zimmerman at Tri-County was going to talk to the team there to see if they would be willing to work with me on that project. Looking at hopefully starting that in February of 2027. Yeah, it's a really great program. If any of you remember Paula Henches, she was at OT, and Paula was certified to do this class. She's not been in our area for a while, and so just really excited to be able to bring it back to our county, because falls are such a
common thing nowadays.
yes, and so yeah, so yeah, scary, yeah. Yeah.
Anything else? I mean, not like that wasn't a lot, but,
Yeah. We're busy, but,
yeah,
yeah.
sounds like it.
Good stuff, though.
Okay, anything from anybody about anything related to the ADRC?
I just want to say I was finally able to attend one of the senior meals events. It actually fit in my schedule at the tailgate in Arcadia at the Wanick Center, and I was really impressed with how many people showed up for that event.
Yes.
Unfortunately, I wasn't able to stay till the very end.
What's the tailgate? I don't, what,
I can tell a little bit about it. for you.
okay.
So we try to, throughout the year, we've started this year, kind of just do like a themed event, our themed dining day. We've done our Western hoedowns.
Right.
This was just a tailgate, so I think there was a Packer game that day or something, or that weekend, something. We just encouraged people, now that it's football season, come in your favorite jersey, just to the senior dining. It's, nothing crazy. Wear your favorite team. So we had a lot of Packers, Brewers, Badgers. And then we played bingo after the meal. So just stayed, played bingo. We had about 40 people come and dine and stay for bingo. Almost everybody stayed, so, which is a significant increase to the amount of diners that we usually have in Arcadia for the senior dining. So it was very, very nice to see. And they served a tailgate meal, so it was brats, potato salad, all the good stuff, so, yeah.
Yeah, we do find that when we have those themed events, that the turnout is really, really high for that. So it would be nice if we had more volunteers to be able to implement some of those things, but we try to do what we can.
And keep the theme simple so that our seniors don't have to go out and buy new things.
Costume or something.
Yeah, just keep
right.
it simple. Game day, Christmas, maybe we do a Christmas sweater or something, just keep it
Gucci bags, something.
Yes,
yeah,
something
yeah,
super
bring your Gucci
simple.
bag.
Everyone has one of those.
Yeah, well, no, I have to go and get one, but, yeah,
Yes, so keep it simple.
thanks. Anything else? So the next meeting is the 2nd of December at 10:30, correct? If there isn't anything else, I'll adjourn the meeting at 11:31.
Thank you all.
Thank you.